I'm Beth Wright. I'm an athletic trainer here at the University of Mobile, and I'm going to be talking to you guys about why athletic training is so important in youth sports. But first, let me tell you about what an athletic trainer is, and we'll go from there. So, an athletic trainer is a healthcare professional and board certified. They collaborate with physicians. They provide preventative services and emergency care. They clinically diagnose, and they help with therapeutic intervention and also rehabilitation of injuries. There's roughly 30 million children and adolescents that participate in youth sports in the United States. High school athletes account for an estimated 2 million injuries, 500,000 doctor visits, and 30,000 hospitalizations each year. There are more than 3.5 million kids under the age of 14 that receive medical treatment for sports and injuries each year. These are children from 5 to 14 that account for nearly 40% of all sports-related injuries that are treated in hospitals. On the average rate and severely injuries, like they get worse every injury they get, like they keep getting more severe. More than half of all the sports injuries in children are preventable. These are just a few actual sport percentages. There's like 28% of football players that are more prone to injury, 25% in baseball, 22% in soccer, 15% basketball, 12% softball, were injured in their sports. These are some athletic training stats that show the difference in why it's necessary for an athletic training to be there. So 55% of athletes at public secondary schools have access to a full-time athletic trainer. According to the NATA, just 37% of public secondary schools have only one athletic trainer, and that's not enough. You think about all of these 6A, 7A high schools that have multiple teams, like hundreds of athletes, and there's one person taking care of all the injured athletes. That doesn't cut it. In 2012, a study by the American Academy of Pediatrics found that high schools with athletic trainers have lower overall injury rates. At schools without athletic trainers, recurrent injury rates were 5.7 times higher among athletes who played soccer and almost 3 times higher among those who played basketball. In 2009, just 42% of high schools had any access to an athletic trainer, but many student athletes still do not get served by an athletic trainer. We've got to do better. So I know this chart is just going to be a little blurry on the screen, but I wanted to show it because it shows you the percentages in each state that have athletic trainers. So Alabama right here has 78%, which is pretty good. That's meaning almost 8 out of every 10 schools has an athletic trainer. But then you go out west and it's less than half. That means all of these kids are getting served by an athletic trainer. In the north, it's as much as 96%. That's great, but it still needs to be better in some of the other states. Athletic trainers know and practice healthcare at the highest professional and ethical quality standards in order to protect the public and their athletes. They are regulated and licensed healthcare workers. They specialize in patient education to prevent injury and reduce rehabilitative and other healthcare costs as well. Because what we can do is we can rehab injuries like PTs and stuff like that, but without having to send them all the time to physical therapy. Some more stats for you. Prevention of injury is critical because previous history is often a risk factor for future injury. Players with one or more previous injuries have 2 to 3 times greater risk of incident or injury compared to those without previous injury, meaning that if they've had an injury, they're probably going to have another one. 25% of public schools in the U.S. do not have a school nurse. 47% of schools fall short of the federal recommended nurse-to-student ratio, and fewer than half of the U.S. public schools have a school nurse on site during all the school's hours every day, which means who's going to cover those football games, basketball games, soccer games, whatever sport's going on, or PE, for instance. What happens if a student gets hurt? Who's there to take care of them? That athletic trainer can step in and take those responsibilities. 96% of Americans agree that there's something important about an athlete being taken care of by a qualified healthcare professional before playing sports. So why is it that we have that conflict of hiring athletic trainers or needing more of them, when we all agree that they should be taken care of in the beginning? So this is a pie chart. It tells you a little bit about coverages at games. Obviously, football being the most covered because it's one of the more dangerous sports. 42% is covered there. 30% are all the other sports. 24% still do not get covered whatsoever, which that's too high of a stat for me to be comfortable with students not getting taken care of. Traumatic brain injuries, concussions, that's something we're all relatively familiar with. It was a big topic in the NFL the past few years. So 1.6 to 3.8 million concussions occur each year. That's 1 out of every 10 athletes. 300,000 are sports related annually. 50,000 concussions from football, almost 20,000 from soccer. That's still not enough. These are the 3 times as many catastrophic head injuries occur in football among high school athletes than college athletes. And 30% of the athletes were playing while still having symptoms from prior head injuries. I have a story about a kid that I went to high school with. He was actually a good family friend. He was playing football at a high school and had concussions previously that no one ever knew. And he got hit again one night in a football game, and they had to take him by ambulance and fly him to the nearest hospital, and he didn't make it because he wasn't taken care of well enough by an athletic trainer and didn't know that he had concussions, and he kept playing. So it is important to tell your athletes the symptoms and signs of concussions and make sure they know about them and how important it is to tell your athletic trainers. In 2012, there were 163,670 athletes seen in the emergency department for a concussion, which is more than 8% of the 1.35 million youth sports-related injuries reported to the emergency department, meaning every 3 minutes a child is seen in the ER for a sports-related concussion. That's an ungodly stat almost. Among high school athletes, concussion rates have risen 200% in the last decade because obviously our kids are getting bigger, faster, stronger, hitting harder, and doing those things that make you have that chance of having concussions. Youth athletes who have been concussed are 3 times more likely to have another concussion in the same season as well. So sudden cardiac arrest is one of the most leading causes of death in youth sports. Athletes could have heart disorders, never even know it. My mom was one of them. When she was a kid, she was misdiagnosed with epilepsy, which was a seizure disease and stuff. And she actually had something wrong with her heart called mitral valve prolapse. And so they later found that out when she was tested further. Without proper emergency care and preparations in response, just 1 out of 10 of these students actually survive when they're not properly taken care of or don't have the right emergency care and plan that's involved. The greatest factor affecting survival after sudden cardiac arrest is the time from arrest to defibrillation, emphasizing the critical need for the availability of AEDs in schools and sporting facilities. Athletic trainers are trained in emergency care and they develop emergency action plans, assist in timely and efficient care for an athlete. So the AED is strategically placed. They have people in place that when emergencies happen, they have people that do crowd control, that keep parents away so that they can take care of the injured athlete and get them assistance as fast as possible. Heat-related illnesses is another big thing that goes on as far as athletic training. 40 high school football players died of heat stroke complications between 1995 and 2013. That's a lot of high school kids. Between 2004 and 2014, there were a total of 38 heat stroke deaths at the high school and collegiate level. The majority of these cases were in football, which was 87%, and to high school athletes, about 74% of them is actually what it took. And they also occurred in the hottest months in July and August. The exertional heat stroke can be prevented, and it has to be proven to be 100% survivable when immediately recognized and aggressively cooled on site. That's as far as like why athletic trainers should step in place is because, first of all, they're CPR certified. They know how to treat heat-related illnesses, and you may not have time to get to a hospital. They keep up with the temperature, the humidity, They have cold pools ready for athletes who get overheated, to where you can be on the scene ready to take care of an athlete when they get overheated. Cervical spine injuries. Over half of catastrophic injuries in sports are cervical spine injuries. Just recently we saw in the NFL one of the guys get carted off on a spine board because he had a bruised spinal cord, which caused him to lose feeling just for a short period of time. It is estimated that 12,000 new cases of spinal cord injuries occur each year in the United States. That's approximately 80% of these injuries also occur in males. Not sure exactly why that is, but it's also a stat. Sports participation constitutes the fourth most common cause of spinal injuries, just behind motor vehicle crashes. Athletic trainers learn how to spine board as well as life or death skills that help until EMS arrives, and they can also help EMS. Sickle cell trait, which is another big deal that if it misdiagnosed or not diagnosed can be a big problem, especially in African American athletes. Sickle cell was the primary cause of death for 15 of the 2,387 athlete deaths recorded from 1980 to 2010. All but one of these deaths due to exertional sickling occurred during practice. That's where your athletic trainer can step in. They're part of the pre-participation physical, which allows for the ATC to talk to athletes and make sure they have been tested for this trait and are aware of the signs and symptoms, so if they have an attack, they know exactly what to do. If that means having an inhaler or whatever it is, ready and being prepared. Athletic trainers are your key to success. They are taught how to deal with each of these situations, from emergencies to ankle sprains to just needing a Band-Aid. They're there to help the athletes get better, get back out on the court or the field, and successfully play and not be injured. They're here to provide preventative services, emergency care, clinical diagnosis, therapeutic intervention, and rehab of injuries and medical conditions. Athletic trainers can be the difference in life or death situations. Thank you for your time.